Good afternoon. Good afternoon.
Hi,
Hello, hello. How are you?
I am good. And you? Happy Monday.
Thank you. Happy Monday to you. I'm doing a screen record just in case anything happens. But welcome. I'm so happy to have you. I was just telling them that you're like a boss babe.
Oh,
And one of the original mompreneurs out there.
yes, I am. On the older side, too.
That's not what I mean. It's experienced, we like to call
It's an experience, yes.
it. So welcome. I'm so happy to be having this chat again. Why don't you let everyone know just a little bit about InnoBaby, how it started, and all that cool stuff, and then
Yeah. So we started our business 15 years ago as a home business. It was me and my business partner who met through our husbands, and we just couldn't find the products that we really needed as a young mom. So we kind of ventured out into making things that really worked for us and that just kind of inspired us to do more. And so 15 years now, after our kids are much older, our business has grown, but we're still very small business, very family oriented, and it's been fun ever since.
That's so cool. I mean, the story of how you and I met, we have to tell. But I found your teethers and I just found that they were so effective with the babies in the population that I was working on because it made my job so much easier instead of always having to show parents how to put their fingers in baby's mouth and they're crying or they're gagging and they're not having it. I like to give the baby control to be able to enjoy it and learn to love this process of oral development and exercise and whatnot. And so your teethers just really made my job much easier. So I started buying them, lots of them. And so somehow I guess you guys realize that there's this random lady in New Jersey that keeps buying teethers.
So we kind of traced you back and realized that you're running you're a therapist, and so we're like, how perfect is that? And we were really excited to know that you're actually using our teethers for your practice because that really means a lot to us.
Yeah, no, they're great. And I always say this, every kid that comes to see me in my office gets one on their way out. Doesn't matter how old they are. So it's their like prize for coming to the office. But yeah, I think that they're so well made. I think that you guys really put a lot of thought into how to make them and why you chose what you chose. And I just think that I want to share that with everybody here.
So
I have a couple of them here today. You probably have more of them sitting on your desk.
yeah, I do. I have like a lot on the floor. Let's see. Well, eventually I'll show you guys everything. Um, but our first design was, this was inspired by, so back in 2012 is when we first launched our Easy Grit Massaging Teeter. So this is our first launch of all of our Easy Grit Massaging Teether series. And the reason why we really loved our design is because it's first lightweight and easy to hold for babies, which was very uncommon at the time in the marketplace. Yeah. So my son, who was is a younger, my second one, was kind of, playing with these really heavy and hard to chew teething toys, and it was just not very baby friendly. And so we wanted to create something that's not going to hurt the baby, even if they're, kind of going all over the place. And so that's how our Easy Grip Massaging Teether was born. And then a couple of years later, we did more of the rattle. So we kind of learned along the way, and we kind of started adding more designs to our teething series because a lot of moms like the fact that these guys are so lightweight and easy to hold. So we now have these fruit teethers. We have the berries here. We got the orange. So we're kind of doing more design series. And then the star teethers, we got a couple different colors. And now we have the flower rattles.
Yes.
And
I love them.
Giselle, you got these samples, right? You like them?
I love the rattle sample. I think, is that your newest one that you guys have?
Well, we used to have this a while back, but it was a slightly different design. So we kind of enhanced the design to make it safer. Because the rattle piece, although we never had an issue before, the rattle piece in the center, it is, we're kind of going through a two-step process to ensure that the cavity of the cap that's holding the beads is going to stay for a very long time.
Right.
So we don't use any glues and things like that to put the pieces together, because what you don't want happening is when baby's playing with this, the beads fall off, right? So yeah, so these are made for not just for rattles, but like you noticed, these little petal shapes on the bottom. It reaches all parts of the mouth, including the back molars and under their tongue. So it really improves baby's oral development.
Absolutely. And that's obviously what I love about them. I'm going to show you here. So you guys, you know, put so much thought into it that all of these little things cause, you know, curiosity and stimulate the baby to want to move their tongue, want to suck on it, want to lick it, and want to, you know, move it around. And that's how you work the muscles. That's how you strengthen them and get that mobility and that range of motion. And a lot of these babies who have had lip and tongue ties have, you know, a lot of negative experience in the mouth. So this allows a positive experience for them to feel it. I love the fruit one for so many, every single one of them I love for a slightly different reason. As you said, the star was the first one that I discovered. And same thing, it has like all these different textures that allow the baby to explore with their mouth. And that exploring is how a baby learns, how their brain gets information and how they learn to use their muscles. And so the cool shape make it easy. It gets to the back. It allows them to move their tongue all over the place and really exercise in a fun way. And as you said, babies are notorious for holding things really tight, but also just randomly releasing them. And so my kids used to bonk themselves in the face all the time. So this is something safe that's not going to hurt them. And if they drop it, they can, like, you know, work their way to get it again until they can figure it out without it hurting them and them getting upset and losing interest.
And I think it's really encouraging for babies too, because it's lighter. So if you're giving them something a little bit too heavy for them to handle, then, you know, they're not going to be able to try. Whereas with our teethers, it's light enough so that they can at least, you know, give it a try. And when they get it done and then they find their teether in their mouth, they get so excited and they never let it go.
Yeah, and it's gentle enough and little enough too that I was actually just using it on a 3-week-old this morning. So I had him in my lap and I was putting it in and around his mouth. And I'll actually might have taken a video. It's not a good one, but I'll post it after this to show you guys that a baby as young as 3 weeks old can still use these teethers and get that exercise and really benefit from it.
And I really love collaborating with you, Giselle, because when our star teether, this star teether, we actually had oral surgeon, like oral dentist, to be on the whole development side of this. And so it's doctor recommended and it was kind of designed with his help. But I never really got to experience and learn how it can be practiced on a day-to-day challenges. And I love following you because you just show and share so much information for a lot of moms. And we've been getting a lot of feedbacks from moms who's actually listening to you and also trying our teethers. And it's really benefiting all of them. So we feel great.
Yay! My best tip for this teether here, so the fruit teether is the magic teether for babies who are having trouble opening their mouth wide to get a nice big latch. And so again, it's graded, it's got nice, you know, different texture that allow them that curiosity, and they can control how big how far it goes back in. So, you know, when I work with the baby, I put it in this way to get them to open really big to get it in their mouth. Some of them don't like it, so I can pull it out just slightly, and we train them to open bigger and bigger and bigger. And so this is really a magic one for any baby who has trouble with latching. With opening wide in order to latch. There's a lot of different reasons why a baby has trouble latching, but this particular teether I highly recommend. The rattle teether is actually my favorite. Now that I know that you guys pulled it and redesigned it for safety, makes it even better. But I love it because you take development into account, and that's basically what I do. I'm a pediatric physical therapist. I love development. I love oral, but I also love motor development and just all kinds of development. And so you use like that age appropriate auditory stimulation. It's not too much. It's not too little. It's really the perfect sound to engage that baby's curiosity, to get them to look side to side, to track, to reach for it. So that little noise just creates this like 2-in-1 teether all of a sudden. And I think that that's just, it's always good when you can get more bang for your buck.
Yeah. So with our teethers, it's 0+. So you can use it as they're infants, and then as they grow, you can continue to use it. Now, like you said, you mentioned about the shape of the grape and the berries, and these are designed in certain widths so that we can actually exceed the safety standards, because we don't want any teethers that babies gag on. And not every baby has different sizes and different openings, as you know. But we're following all the safety guidelines to meet that standard, and that's also benefiting your patients too. So I'm glad to know that from your aspect.
Yeah, I guess wider is better for me.
Wider is better for you.
Yeah, that's really cool. It's funny, right? Because I don't design toys. I just dream of them. So, you know all the ins and outs of safety testing. And I remember you telling me when we initially talked, and I was so fascinated that this is actually like one big piece. It's not two pieces that are together.
Yes. So we double mold the top and the bottom piece. There used to be more manufacturers who are kind of copying what we're doing on Amazon, and what they did was they used silicone glue to put the pieces together, and that doesn't stay long. But they've caught on, and more companies are kind of following what we're doing right now, but we try to stand in front and lead instead of follow. And we really focus on finding the right materials so that we don't cheat on, getting a cheaper material, which is probably not good for your baby. So you have to be watchful of, making a purchase online, and always go with the brand that you trust.
Absolutely. So yeah, you can find these on Amazon, but make sure you're searching InnoBaby and that you're buying the ones that are not the knockoffs. I recommend going right to your website. Of course, I do have an affiliate link, but I can send that to you. You'll get an additional discount as well if you don't want to wait to be entered in. I love them all. I think that they're great. Like I said, you take development into account. You're a mom boss. And I mean, I just couldn't be happier to be working with you guys.
I feel like I'm a mom slave. I do so much. But that's the fun part, right? Aren't we all?
Yeah.
Like, mom this, mom that. But thankfully, my kids are now all matured and they're grown. So InnoBaby is my baby now. It's my only baby.
So let's go through and take some of these questions here. I gotta scroll. Dana Ray says, my son's tongue tie release was this morning and he's already nursing so much better. Thank you for your post. Oh, Dana, I'm so happy to hear that. That's great news. Definitely grab some of these teethers because it's gonna make the rehab process so much more fun for your little guy. Let's see, move it along. Trying to scroll through. How long after tongue release does it take to retrain the tongue? 3 weeks post frenectomy over here. Doing oral motor exercise daily. Jocelyn, thank you for your question. I would say that starting oral motor exercises is really very important. If you feel like they're not the right exercises or your baby's not catching on, it may be helpful for you to go and find a specialist, a therapist that can really help you. Send me a DM and I can help you find somebody that's in your area. Let's see what else I have here. I'm really bad at. Carmen. Oh, Carmen answered for you. Carmen is a sweet friend of mine that's taught me so much. And she says it can really vary depending on the time when the procedure was done. If the exercises were done out, severely restricted the oral time. It can be from weeks to a few months. Great answer. Okay. Cool. Any other questions? Just pop them right in. We had so many questions last time.
We sure did. I wish I could for all of them. We lost all those quick.
I know. I was so frustrated all evening about that, but it's okay.
So in your recent blog, Giselle, you wrote about how breastfeeding is related to tongue tie release. Can you, why do breastfeeding moms sometimes have hard time latching on their babies when they have certain issues like that?
So the tongue is really front and center for breastfeeding. So the tongue has to suction up and move and act sort of as the primary muscle. Just like if you were carrying grocery bags, you have to use your bicep muscles. That's your primary muscle. So the tongue is really, among others, the primary user. So a lot of times now we're finding the women that are having trouble or pain with breastfeeding, we're able to flag these babies that have tongue ties earlier. Before, they would maybe have trouble breastfeeding and just stop and move on to other things, or they would lose their supply and they would never know really why they couldn't breastfeed. They would think that they didn't have enough milk or whatever, when the trouble was that the baby's tongue was just not able to really keep up to do their part so that you could breastfeed successfully. So we're seeing more and more now that this is sort of early signs of a tongue tie, and we're able to address it earlier.
So they are able to latch on, but they just can't breastfeed for a period of time? Like, what's the difference?
So I see sort of the gamut of things going on. So some babies cannot latch at all. Some babies have trouble latching, so they're popping on and off because they can't create that proper suction that they need. And some babies will latch on, but they chomp, chomp, chomp. So they're compensating in a way that's actually damaging mom's breast tissue. Mm-hmm. And so those are the ones sometimes that have the hardest time because the baby is getting the milk that they need. And so the doctor is saying there's nothing wrong here. But they're not looking at what the compensation is to identify and really understand what the tongue tie looks like and the cause.
Because my baby used to chomp a lot. And I used to be terrified to latch him on. But eventually he got better and we kind of solved it. But at that time, I don't think we had any therapists who could help us. I was just talking to my breastfeeding specialist who was helping me. Yeah. And I had like really no breast milk supply after like 7 months because I had some other health issues. And so like my first son, my first motherhood was a lot of trial and error. And I was going through a lot of ups and downs. And so when I recently read your information about the whole breastfeeding challenges being tied with tongue tie, I just I never saw it from that angle, but it totally makes sense.
It totally could have been, exactly. And I think too that sometimes it alleviates the guilt off the mom a little bit because they think, like you said, that there's something wrong with them or like they're not producing enough or whatever it is. And I feel like when we can point out to them, no, there's objectively something here that we could do to help your baby to restore this relationship, it really helps them to be able to bond and like, you know, just be able to stick it out a little bit to get through that process. And I think my whole goal of my Instagram account is to just empower women, educate them, and show them that, like, you know what's best for your baby. If you feel like this could be something, like, talk to your doctor. Don't take no for an answer. There are answers out there. And I just, you know, help them through this process because it's hard to navigate when there's a doctor telling you, oh, the baby's fine. I know your nipples are bleeding, but it's normal.
You want to really tell them, no, it's not fine because I don't feel fine. But they make it sound like it's normal, which, especially back then, I didn't have easy access to the internet. We didn't have cell phones at the time, so I was just kind of following and listening to what the doctors had told us. And they kept on telling me, you should have more breastfeeding, breast milk supply the more you nurse. And I literally got no sleep. Like I would nurse, and then I would let him down, and then I would pump for an hour, and I started to bleed. I mean, it was just a mess. And later I found out that I actually had thyroid issue.
Wow.
Yeah, which is very common for mothers who gave birth, and I didn't know that until after everything was found out, and it was too late because all I had to be on was hormone therapy, but because I missed that chance, I couldn't breastfeed after 7 months, and so that was kind of.
Well, thank you for sharing your story, because I know that you're not alone in that. And so many women feel like, there's no answer. Like, oh, I guess I just don't have it, or maybe I'm not pumping enough, or whatever. Why is it hurting? Oh, the doctor says it's not hurting, but it's hurting. And so it's like, you must have been putting that pump so high. I bet you that you were causing damage when, like, if they just looked at your TSH levels, we would have understood right away why you're having trouble producing milk.
Yeah.
Anyways, hopefully we're like expanding just the body of knowledge and like helping. I don't want to just educate moms, but also educate the healthcare professionals, the other doctors out there that like really listen to, there's more out there that we're learning that we all have to learn together.
Right.
I'm not, I'm not here to tell anyone that your pediatrician is inept. They're good at their job, but just to educate them too, to understand that things are changing and that we have to have a broader look at things.
I think as moms, we can empower ourselves by just being educated and learning. And we have so many great resources out there. And you do have to kind of be picky about who you listen to and who you follow. But as long as you're open to getting more information and filter through it to make it yours, I think you can really find a solution for a lot of the problems that we're experiencing as a mom.
Yeah. And I also say, in addition to that, is to trust your mom gut. I say this over and over. It's a gift that we were given to take care of our children. And it's like a muscle. The more you use it, the stronger it gets, and the more you're able to trust it. But I always tell this story that my firstborn, she was, 3-4 months old. My husband is a pharmacist. And so I picked her up from her nap one day, and I was like, she's warm. And she'd never had a fever before, so I didn't know what it felt like. But I just knew she felt warm. And I said, I think that she has a fever. And so he ran, grabbed the thermometer, took her temperature. And, she didn't have a fever. And he was like, see, you're always overreacting. You're such a drama queen. You make all this stuff up. Made me feel like I didn't know what I was talking about. Well, don't you know that within 20 minutes, she developed a fever of like 102. She ended up having RSV. We took her to the hospital. She needed like all this medicine and blah, blah, blah. But it was just a good lesson for me that sometimes we know better than other healthcare professionals, than a thermometer. It's our gift, and we have to start trusting and listening to ourselves. And, I put that out there not to make anyone feel bad, but just to like let you guys know that we have this gift and we have to use it. I call it our superpower.
Absolutely. I think it's all within us. We just need to kind of trust ourselves a little more.
Yeah,
and,
absolutely.
Be more informed, and we can make a better choice for our children, our family.
That's right. Let me see. There's a question here. Stepahoni says, that's me. 8 weeks old, is growing great, but nursing is difficult. Our pediatrician kind of dismissed my concerns, and we got second opinions, and she has a lip tie and tongue tie scheduled for this Thursday. Well, good for you for, trusting your gut and finding the right answers. I'm not saying it's an easy road. There's a lot of things that you should line up to make sure that this whole process is successful. But definitely I'm here, and send me a DM if you need any help along the way. Excellent. Cool. So if nobody has any other questions, I think we're going to sign off. Do you have anything else you want to talk about, G?
How cute these are.
And you're even cuter with your little like rattle maracas.
I'll do it again right now. Do you guys want to see like all of our designs?
Yes.
Okay, so this is our, let me start out with our star. So this is our star pink and the blue, yellow, and my dog loves this too. I have a small Yorkie and he loves it. This is our grape, berry, and I have orange in this case, and then our 2 rattles. Oh, and if you guys do want, these guys are going to be also available for your choice, as your choice, our first stone room teethers.
Yes,
So,
those are so cute.
Yeah.
And I just have to add that InnoBaby does a whole lot more stuff than teethers. I just happen to talk about teethers all the time because of my line of work, and I love them. But I mean, they just have great things. They have lunch boxes and spoons and like so many things I can't even, like, there's just a lot of stuff out there. Yeah. And the little backpacks. Yes, there's so many fun things that you have on your website. And does my code work for everything on there?
Yes, it does. Yes, it does. It's our 15 years of sweat and tear for developing and bringing all of our products together. And Kristen and I really, really focus on providing something that we believe in. So if we can't use it, or if we don't feel comfortable using it, we won't even put it on our product list. So
I love that.
It's really blessed for this opportunity to be able to do what we do.
Yes, no, you guys are doing a fabulous job. I 100% support you. I love that you're women owned, and that, like you said, you'll use something that's a little bit more high quality to keep that superiority to your product. And I really appreciate that as a therapist.
Thank you.
All right, guys, we're going to wrap up. Thank you so, so much, G, for coming and for talking to me twice.
Well, thank you for the second opportunity just as well.
And I'll post my code. Go and support them. Happy shopping. Your kids are going to love these. And we love when you tag me and tag InnoBaby with your baby playing with these toys. I will repost them. It's always so much fun to see their tongue.
Yes. All right. It was nice meeting you all.
Thank you so much, and we will see you later.
Bye.
Bye.